Mr. Chairman, dear colleagues, I'm very pleased to report our experience about second and third laparoscopic liver resection for colorectal liver metastasis with recurrence. So, it's not in use, but repeat hepatectomy for the treatment of recurrent colorectal liver metastasis is widely accepted with favorable outcomes. However, data about laparoscopic approach are poorly analyzed in the literature. So the aim of our study was to assess the short-term and the long-term outcomes after laparoscopic repeat hepatectomy for recurrent colorectal liver metastasis. So this is the experience of Professor Gaillet in our center in Paris, with a total number of more than 700 laparoscopic liver resection. And as you could see the experience of Michael Kendrick in the previous session, the rate of open liver surgery are significantly decreased over time. So this is a synopsis of this study, including more than 200 laparoscopic liver surgery for colorectal liver metastasis. Among these patients, 162 had recurrence. Among these patients, 67 underwent second hepatectomy, and among them, 50 developed recurrence, and 20 patients had third hepatectomy. So, this is a short presentation, so I don't have many slides, but I just want to present our comparison between patients who had only one liver, laparoscopic liver surgery, to 47 patients who had only two, and 20 patients who had three or more than three laparoscopic liver resections. So, on this slide, you can see that there is no significant difference according to patient age, male gender, BMI, ASA, or comorbidity. Interestingly, the rate of neoadjuvant chemo or adjuvant chemo was not significantly different, but it was exactly the same for tumor size, which was quite limited, nearly 25 millimeters, and tumor number. So the rate, as expected, the rate of major hepatectomy decreased over time. Of course, patients who had right hepatectomy for the first liver resection could not have another major hepatectomy for the second one, but the rate of major hepatectomy decreased with the number of procedure. Pringle maneuver was increased in the third time, but without significant difference. Operative time was quite similar in the three groups. The blood loss was similar with a constant rate of intraoperative transfusion. The rate of conversion to open surgery was low, below 5% in each procedure, and the rate of R0 resection was acceptable. So one patient died in the first group, and no patient died in the second and third group. The complication rate was nearly 30% in all the groups, with no difference. There is a constant rate of nearly 20% of liver-specific complication. Major complication represented 20% during the first stage, the first liver resection, but some patients had a combined colorectal primary tumor resection, and the rate was nearly 10%. Less than 5% had a reoperation, and the length of stay was between 7 and 9 days. This is last slide. So we observed a 5-year overall survival of 50% in all these patients, and we can observe that the long-term outcomes are favorable with the repeat liver resection. So my conclusion is second and third laparoscopic liver resection are feasible and safe with favorable oncological adequacy, and a laparoscopic repeat hepatectomy might be a favorable surgical option for treatment of recurrent colorectal liver metastasis. Thank you very much.